So, your mental health provider wants to start you on one of the most common and safe medications for anxiety or depression or other mental health symptoms, an SSRI. You may be thinking, okay, great, maybe this will help. But then the worries start to seep in. Could this make me feel even worse? Or cause terrible side effects? Or change who I am? You've probably heard horror stories about starting medications or scrolling through too many Reddit posts at 2 a.m. I get it, it's a little scary when you don't know what to expect. So in today's video, I'm going to walk you through what to expect in the first week of starting an SSRI. The good, the bad, and the gassy. Welcome back to Shrink Talk with Dr. Robert, hosted by me, Dr. Robert, a board-certified psychiatrist. And in today's episode, I'll be discussing the very common experience and concerns over starting an SSRI, the most commonly prescribed psychiatric medication. So first off, SSRI stands for Selective Serotonin Reuptake Inhibitor. Yes, it's a mouthful. But basically what it does is it alters levels of serotonin in the brain, which is a chemical that is involved in mood or experience of anxiety, sensations, and many other things. And yeah, just the general vibe of your existence. Though I won't get into how we suspect SSRIs work in this video, but I will discuss how we experience starting a medication that alters serotonin levels in our brains. They're a medication with a very good safety profile, taken by over 35 million adults in America and many more around the world. So if you're taking one, you're definitely not alone. And they're used for all kinds of mental health conditions, everything from depression, anxiety, OCD, panic attacks, PTSD, eating disorders, many conditions. But the real art and science of it isn't deciding whether or not to start an SSRI, though of course some is involved in that. It's managing the medication once you've started it. So managing the dose, what kind of dose, when to switch, when to stay the course, when to add another medication, subtract a medication. And everybody's experience of a medication is unique to themselves. That's why there's no single answer or blanket statements that I can give around this. So it's a matter of treating everyone as an individual. All right, so that first week of starting an SSRI, now go over why I call it the hang tight zone. All right, so here's the deal. Don't expect to feel any better, have your symptoms go away or greatly reduce in that first week. In fact, if anything, you might feel a little bit worse. Totally normal. Just kind of like most things that help in the long term, they're kind of not the most pleasant in the short term, right? So like even therapy, exercise, improved diet, at first there's a kind of an adjustment period you have to go through. Same with these medications. Probably the most common adverse effect people experience in that first week is experiencing some tummy tantrums. So this can be increased diarrhea or constipation, a little bit of nausea, bloating, and this kind of makes sense because, believe it or not, you have more serotonin receptors in your gut than you do in your brain. So first, your gut has to adjust before your mind. You might also experience some headaches or dry mouth or some tension in your jaw or even frequent yawning. Some people even feel a bit more anxious or moody at first. I know. You're taking this because you want to feel less anxious, less moody, less depressed. But again, it's just that first week and definitely things typically get better for people. And if it doesn't, talk to your doctor. People often ask before they start this medication, should I take it in the morning, at night, does it matter? The real answer is that actually it doesn't matter what time you take it. But for some people, it makes them a little bit more drowsy, so it's best to take it at night if that's the case for you. Or if it makes you a bit more activated, interrupts your sleep, then best to take it in the morning. I would say for a lot of people, it doesn't make any difference, whatever works for their schedule. No right size fits all answer. Sometimes people feel a bit hesitant asking about this, so I often educate them on it. It's the question of, can I still drink on this medication? Alcohol, the question on everyone's mind. Of course, it's always best to avoid alcohol whenever starting any new medication. But even outside of that, we know alcohol contributes to worsening of all mental health symptoms. It doesn't really help in anything. Maybe in the short term, you'll feel a bit better, right? Getting a buzz, but definitely alcohol exacerbates all mental health symptoms and can make you feel much worse than better and slow down your recovery. So I typically advise people, to avoid alcohol whenever they can and try to avoid it for that main reason. Another reason to avoid alcohol when starting a new medication, especially an SSRI, is it can affect your tolerance to it. It's not exactly clear for what percentage of people this happens, but for some, especially in the first few weeks or months of starting an SSRI, their tolerance may drastically reduce. So like one beer feels like 3 all of a sudden, and so that can make any sort of drinking much less safe. Though, to be honest with you, I understand most patients, they don't really change their alcohol use too much when starting an SSRI, and I've never seen anything terrible happen. But of course, give a lot of caution. So maybe skip the bottomless mimosas for now. Yep, it can mess with your sex life. The most common sexual side effects from SSRIs, especially when starting them, would be delayed orgasm, decreased libido, or erectile dysfunction in men. This doesn't happen to everyone, and if it does, it typically happens in the first few weeks, first week or two, and then it goes away. But if it doesn't go away, or it comes up months later after starting or after increasing a dose, don't suffer in silence. Bring it up to your doctor, even if you can't get it up. The reason is we're trained to manage any sort of sexual side effects if they do arise. There's ways around it to mitigate it. It's not something you should have to put up with. It's kind of an interesting one, because definitely the data, the evidence isn't very conclusive and supportive of this. I definitely hear it enough that it's caught my attention, and I see it as a true phenomenon. Might be placebo, might not be, I don't know. Plenty of my patients tell me that in the first week, they actually feel an improvement in symptoms. They feel like they got their anxiety drastically reduced, their mood lifted. Because when patients do tell me this, I notice that it doesn't always persist. Sometimes it's kind of this kind of uptick and feeling better in the first week, sometimes two, and that sort of goes away. And then that effect does come back weeks later. That's because SSRIs, they're not supposed to start working until several weeks in. There are some conditions or exceptions to that, but for the most part, it's around week 4 to 6 that you start to see the effects of it. Either way, if it happens, enjoy it. Not a bad thing. So another thing that I wanted to definitely address was the black box warning that comes with SSRIs. And it's about the risk of increased suicidal thoughts or actions in individuals up to the age of 24. And that was given back in 2004 by the FDA. And it's definitely had a lot of controversy since then, probably for good reason. Since then, subsequent research and large data from large populations has thrown a lot of controversy about the accuracy of that sort of statement, and it doesn't seem to be as much of a concern or a risk as originally thought. Another area of concern is that it did then lead to reduced diagnosis and treatment of depression in young individuals. And certainly that does have an effect on increasing suicidal actions and thoughts in young people, right? Because you're treating it less, you're diagnosing it less, so that's definitely gonna have a negative impact. So there's a lot of controversy over now wanting to reverse that black box warning because of that main factor. It's created a lot of concern around the medications and the diagnosis of depression in general, and so it's potentially led to more harm than good. Also give the caveat that in my 5+ years of prescribing SSRIs, certainly I've never had anybody start one and then grow suicidal as a result. That's nothing I've ever seen, and many of my colleagues also do not report that. Certainly sometimes we do see anxiety get a little bit worse, some changes like I talked about earlier in the video, but never to that degree. So what I tell my patients is this: certainly this is a concern, especially for younger people. I would say especially 18 and below. Patient population that I don't treat, but that's, I think, where it is more of a concern and more of a risk. But certainly in adults that I treat, I tell them that no matter what issues arise, what symptoms, there's always a line of communication. So you can always stop the medication and just let me know what's going on, and we can definitely address any issue that comes up. Nothing that we can't handle, that we can't address together. Because I want them to feel confident in addressing their mental health and starting a medication if that is what we think might be helpful for them, and feeling comfortable to bring up any concerns, any issues that may arise. So I definitely advocate for you guys out there watching. So long as you have a good comfort level, good line of communication with whoever is prescribing your medication, you should feel safe and in good hands. I hope that clarifies it. So, if you're in the middle of week 1 and wondering, what have I done? I'm experiencing all these side effects, rest assured, most of it is expected to improve very shortly. And if it doesn't, reach out to your doctor, talk about what's going on. There's definitely many ways to address any issues, switch medication, tinker with it, or stop it completely. And having that conversation with your doctor is always the right way to go. Thanks so much for watching, my friends. I really appreciate it. If you've had your own wild ride with an SSRI, starting a medication, I'd love to hear your stories down in the comments below if you feel comfortable sharing. And if you have any questions, I would definitely love to answer either in the comments or in future videos, and keep talking about these mental health topics. Thanks so much, my friends. Until next week, and I promise to you, my friends, your brain's probably doing much better than it's giving you credit for. Take care.